For 2 decades, the global health order rested on a bargain. Wealthy nations would finance, multilateral agencies would coordinate, and the rest of the world would receive. That bargain is fracturing, fast, chaotically. Development assistance for health has contracted by a fifth in a single year. Programs are being cut badly. Gains, painstakingly built across a generation in HIV, tuberculosis, malaria, and maternal survival are now exposed to reversal. And the nations, carrying the heaviest burden of disease, who have had the least say in how the system was designed, are bearing the brunt of its collapse. In Accra in 2025, a summit of African and Global South leaders convened to shake the status quo. The first premise was that health cannot be transformed in isolation. It must be the vanguard of a broader reckoning with the architecture of development itself. From that insight, the Accra Reset was born, a head-of-state-anchored movement that treats sovereignty as a discipline to be mastered and executed with finesse and passion. Health was chosen as the proving ground because no other domain so visibly exposes the distance between rhetoric and lived reality. Where a mother gives birth, where a child is humanized, where a pandemic is contained or spreads unchecked, there shall sovereignty be measured. Accra Reset's health architecture stands on 3 pillars, each addressing a different structural failure, and together, governed by one sovereign logic. First, normative reform, an 18-member high-level panel on global health architecture and governance, co-chaired by El Haj Asi, Nizia Trinidadi, Peter Piot, and Budi Gunadi Sadikin, with Michelle Sidibe as special advisor, is producing politically anchored recommendations for how the rules should change. Second, institutional interface. Through the high-level consultative group, the Accra Reset engages directly with the WHO, Gavi, the Global Fund, and other key institutions as each undergoes major reform, ensuring that coalition coherence overrides institutional competition. And third, sovereign delivery, HINGE. The health infrastructure and investment ecosystem offers an operational engine to convert insights and pledges into real outcomes at the country health. Maternal health, bioinnovation, universal preventive care, designed for countries, governed by countries, and built to scale from the district clinic to the continental supply chain. Accra Reset refuses to treat health spending as a cost line. Its health multiplier doctrine frames health systems as engines that compound value across an entire economy through more productive workers, through industrial capacity, in pharmaceuticals and diagnostics, through trade in health commodities across the continent under AFTA, and through the resilience that prevents a single outbreak from erasing a decade of growth. When we invest in health, sovereignty compounds. African leadership in global health is not a novel claim. In April 2001, Olusegun Obasanjo hosted the Abuja Summit and stood beside Kofi Annan to demand a global war chest against AIDS, tuberculosis, and malaria. The institution born from that advocacy, the Global Fund, has saved over 65 million lives. Its governance ensured that recipient nations held enough weight for genuine leverage. One leader's foresight wove Africa into the creation pact of a global institution. Geneva is where these currents converge, as key institutions such as the WHO, the Pandemic Fund, Gavi, and the Global Fund navigates their own reforms. The Accra Reset clarion call gathers stakeholders from across the world in one room, at one moment, under one proposition. Sovereignty must be the organizing logic that binds these reforms into a single coherent direction of travel. A new chapter in global health governance begins when those most affected by its failures lead the redesign. This is a clarion call from Geneva, and the world that answers it will be healthier, fairer, and finally sovereign.